Knowing whether you have COVID-19 antibodies can bring some peace of mind as the country reopens, but many companies are making false claims about their tests, what could lead to a false sense of security. Amanda Brandeis looks at how to find a reliable test and when you might be able to get one delivered to your home.
Every person on planet Earth is nervous. Did I have it? Do I have it?
Considered the coronavirus holy grail, antibodies are believed to give us some level of immunity from the virus.
There is some really great companies building antibody tests, and there are some not so great or some bad actors that are building antibody tests.
The FDA is now cracking down on the bad actors, making a list of tests that should no longer be distributed. Only a handful of manufacturers have been granted FDA emergency use authorization, meeting a certain threshold for accuracy. You can also find this list on their website.
We were talking to a city government, a big city, and were blown away when we got a response that they were thinking about buying antibody tests from a certain manufacturer who had claimed that they were FDA approved.
John Carter is the co-founder and CEO of Vessel, a company created 4 years ago to provide an in-home wellness test.
So this would be what would come in a at-home antibody test if you were going to.
They've adapted their technology to be used in the fight against COVID-19.
So we take existing antibody tests, the good ones, the ones that are very accurate and the ones that the FDA has approved for emergency use, and we enable those to be done safely and accurately at home.
Antibodies form after a person has beat the virus. Vessel created a kit to do the blood test at home.
People are scared to prick themselves. So this one, actually, as you can see, there's like no needle popping out. It's just flat, and you just push it against your finger until it clicks.
Once your blood is on the test card, it's scanned through the Vessel app, providing results within a half hour from a medical professional.
Hey Dave, how are you?
The FDA has already approved in-home tests to diagnose active infections, but Carter says the sample must be sent to a lab and the user must have symptoms or another qualification to get one.
Ours could be one of the first antibody tests or the first antibody test that can be done entirely at home, no lab needed.
It would cost anywhere from $20 to $30, and if approved by the FDA, Carter estimates millions of people could get tested within the first month.
And there's something really great about the peace of mind that comes from doing a test. That might be one of the biggest benefits.
In San Diego, I'm Amanda Brandeis reporting.